So I'm Emily. I am a family nurse practitioner at OnePeak Medical, and I was just coming today to kind of tell you guys what we do at OnePeak and how it might be able to help some of your clients.
Awesome.
Yeah. So we do integrative medicine, which means it's the best of both worlds between conventional medicine and it's functional medicine. It's kind of an alternative, almost like an alternative healthcare. So one of our big focuses is on hormone balancing. And I think a lot of people just don't realize what that is and all the things that can be involved with a hormonal disorder. So what happens with a lot of women is they think they're losing their mind. A lot of times it can start at any time, but usually like late 30s, early 40s, women start in the perimenopausal time where their mood is changing. They might have hot flashes, night sweats, any kind of period changes. And just women are just taught that like, oh, that's just part of it, like live with it. No, like we can help you in a very, very healthy and helpful way. Postmenopausal women, it's after they're not having periods anymore, they will definitely have hot flashes and night sweats, a lot of mood disturbances, sleep disturbances, changes in concentration, changes in libido, and just inability to lose weight and build muscle. So they're working, and they're not getting anywhere. So when you see somebody that, okay, their diet's right, they're doing the exercise, but they're truly not getting any results, like send them our way. We will do a full hormone panel on them. And it's kind of funny because some patients tell me that they have had a lot of labs done. And I look at their labs and they've had like 3 things done, right? So I'm going to look at their complete blood count, their electrolyte, liver, and kidneys. A full hormone panel, which is for women, it would be estradiol, progesterone, testosterone, really the same for men, but they're obviously weighted, the hormones are weighted differently. I'm going to look at their thyroid, a full panel on their thyroid, whereas most providers in conventional medicine will just do a TSH and say, oh, you're fine. The TSH is actually just a signaling hormone. It doesn't tell a lot about how much of that actual thyroid hormone is active and working in the body. So that's why we do the full panel on that. We look at your adrenals, which would be your cortisol and your DHEA. And we look at your major vitamins, vitamin D, B12, and ferritin, which is iron storage. I really like to get a fasting insulin on everybody, because that's another thing that could be affecting your weight. Is if you had insulin resistance, that means you've got all this insulin, but your body's not able to use it appropriately. And fat will follow insulin. So if you have insulin resistance, if we're not doing something for that, then you're not going to lose weight. And of course, I like to look at a cholesterol panel as well. So we do optimal values. So when you look at like regular conventional medicine, they have these, I mean, for some labs, you do kind of follow the norms, but for like your insulin, your hormones, your thyroid, you want to be optimal. So lab standards are made by the last like 10,000 patients that have that lab done. They average those together and call that normal. Like, that's disgusting, but that's literally how they do it. And that's why every few years, the testosterone levels, like the norms, go down, down, and down. So, a man 20 years ago would have been told he had low testosterone. Today, well, that's normal because we lowered the reference range. So it's just a little bit about what makes us different, as far as normal or optimal. Like a normal vitamin D level would be, let's say, like 30. So that is just enough so that your bones aren't disintegrating and to prevent osteoporosis. But an optimal vitamin D level would be 60 to 80. That's enough to protect your immune system and to support your hormones and to help to prevent depression. So that's just kind of the difference there. For men, hi. I'm Emily. I'm a provider at OnePeak Medical. I was just kind of telling them what we do, and the different hormonal things to look for people that we can work with.
Okay, I'm Brandy. Nice to meet you. Sorry I'm late.
Oh, you're fine. You're fine. So with men, men are often told that their testosterone is normal because they go to a normal provider and they, the reference range for testosterone is 300 to 1200. And if you're in that range, well, you're normal. Sometimes if you're like just under the reference range, they're also told they're normal. So they may, if they're 250, they're told they're normal. But the reference range does not break down age or that person's activity level. So somebody who is super athletic, somebody who has these high adrenaline jobs, kind of we were talking earlier, like military, police officers, definitely athletes. Those people are naturally high testosterone people. So for them to be at a, let's say, I'm just going to make up numbers, 400, that would be very low for them. But if somebody's more of a laid back person, they've never been, super active or competitive in their life, they may just feel just fine at 400. So we do like to kind of get to know our patients and to figure out how they've been their whole life and treat them as an individual. So men, when they start getting low testosterone, usually they'll just start saying, something's off. I'm just not as motivated as usual. Like, I know I should work out, but I don't care. I'm just not motivated. That's not me. Or used to on my days off, I had all these different projects, and now I'd rather just lay on the couch. They do their job, but that's it. Like I hear that every day. They start getting tired. Maybe not, severe, but it's just different. They're needing more sleep. They're just, something's off, and sometimes they can't even describe what is off. They're like my oomph is gone. Like I'm just not myself anymore. So, that's definitely a sign that we need to check their levels and see what's going on. Everybody, I was saying earlier, everybody has it in their head that low testosterone is just sexual issues like low libido and erectile dysfunction. First off, hardly anybody's talking about that. But if that is the case, it's usually been going on for a while. Like it's usually these mood changes that are happening before. Another thing is men will say that they're just not building muscle like they used to. Like maybe they are having the motivation to work out, but they're just not making gains like they used to, or they're even losing muscle. Like that's definitely a sign that we need to check their hormones, or that they've got more belly fat, which can also be a stress issue, but we need to check their hormones. And again, we don't just check a few things on people. We do that whole huge panel, initially, and depending on the symptoms, and we correct what's off and optimize it. So we do a holistic approach. We have a nutrition specialist that works with us, and they really work with, what are you eating? What's your exercise activity like? Are you drinking water? How's your stress? We like to address all of these things. And then, of course, the providers do the medication changes and monitoring of the labs.
Yeah, I know, just kind of speaking to that from my side of the house, as far as the, the police, military, and fire, we'll kind of go back to that, is just because somebody might be actually in shape visually doesn't necessarily mean things are working well within them. There's a guy by the name of Dr. Parsley, who was the team medic for SEAL Team 3, and he was talking about how he did all these, he did the blood work, full blood work panel on all his guys. I mean, these guys that were in their, early 30s, late 20s, and look-wise, they looked like they were like, 18 to 22. I mean, they were just that physically fit. Mm-hmm. But when the panels came back, they had the metabolic profiles of like 60 and 70-year-olds.
Yeah.
So just because, just because a client, this is to the trainers, just because your client might be in shape, if something's feeling off, sleep's all funky, that also might be a good recommendation to send them into OnePeak.
I want to volunteer as the local guinea pig. I actually have 3 very, very good friends that come to OnePeak. 2 of them have been coming for a while and say it changed their lives. One is new. It hasn't quite worked that way yet for her, but it seems like a good thing. I've been hearing about you guys from my friends for a while now.
Yeah, yeah. Anytime you hear somebody that they're just like, if they're having weird symptoms. So if their symptoms seem like they're all over the place, I'm like, it's not that you're having, you know, because they come with a symptom list like that. And I'm like, you don't have 30 different problems. You know, we're not going to treat each individual symptom as if it's not related to the other one. Like these things, you know, hormones affect so many things in our bodies that the symptoms can present like, hey, I'm a mess. But no, you're not a mess. You're just having an imbalance of this, you know, and once I fix this, you know, it's like this chain reaction with hormones. I usually describe it like a spider web, you know, like if you pull on one string in the spider web, like other things are going to kind of shift and change and move out of place. So that's kind of how it is with fine-tuning hormones. And there's not, you know, any 2 people that are the same, but these are some very, very common things that we see. For women, any period issues, you know, like women come to me after their periods that, you know, their periods have been bothering them since junior high. You know, they've been missing work and school since junior high. And like, I probably could have fixed that 20 years ago if, you know, if I'd been around and, you know, if in the right situation. And it's easy. So it's actually some easy hormones for period issues. It's usually that they need progesterone. And let me reassure you, so hormones kind of have a bad name because of some very poorly designed research studies. So every single study that's negative, they found that it was a synthetic progestin that was causing cancer, that was causing blood clots and heart attacks. You know, so it just gave hormones, like all hormones are bad. It gave them a bad rap. But every single study on the bioidentical progesterone is positive, meaning it helps with mood. It actually prevents cancer. It helps with sleep. It helps with all the hormones. And for women, if we can optimize their progesterone levels, that can sometimes just set everything into place. And that said, sometimes premenopausal and menopausal women need testosterone too. So we have, you know, we don't have a ton of testosterone like men do, but we need a little bit because it's so important for our mood, our brain functioning. I mean, women will be like nearing menopause or after menopause, and they think they have dementia, like because it just causes such a bad brain fog, and they're having trouble at work, like they're scattered, they're forgetting to do things, you know, and it's like, oh wow, once I get you know, optimal levels of testosterone, like they're better. And for women and testosterone, it's kind of the same, where I said, I need to know the person, you know, because I've had these women that, you know, I look at their labs and I'm like, oh, well, your testosterone's, let's say for women at 50 to 150, say you come in and you're at 70. That's pretty good, right? Well, she's got every symptom of low testosterone, and she used to be a competing gymnast, you know, or whatever, or she's like somebody who graduated, you know, school early and opened her own business and has raised 5 kids, and you know, like super go-getting people. Like you naturally need to be like closer to the 150 mark. So those women too need testosterone. So it really can just be like these clusters of symptoms. Anybody with gut problems, we can also definitely help with that. We use our nutrition specialists a lot. We do some of the advanced testing on the stool testing to see if there's something wrong in the microbiome, which is the bacteria in the gut, because stress can cause that to be off as well. So any kind of GI symptoms, also, you know, and you know, a lot, I've had patients say, you know, I've been to this specialist, and this specialist. They did like all these, you know, thousands and thousands of dollars of testing, and I didn't get anywhere. And you fixed me within a month. it wasn't hard. It was some simple dietary changes, maybe some supplements, maybe they have a parasite, maybe there's a bacteria in their gut that we find on stool testing. So those are other people that just send them our way.
What and what of the interventions or testing do you have that's typically covered by insurance? Is there anything that you guys do as far as like the stool testing, for example, that is not typically covered by insurance? Just because I know a lot of clients might be apprehensive about shelling out of-pocket cash, while obviously it's not going to be on the trainer or within the trainer's scope of practice to diagnose or recommend a course of action. Kind of being able to address that aspect of it would help to kind of break down those barriers to get them to you.
For sure. No, that's very important to know. So when I do the blood work, I code it so that, I use their symptoms as diagnoses, and then the insurance should cover that. So, I always say, I don't know if this is going to go to your deductible or not, but the blood work that we do are things that generally insurance should pay for. As far as the stool tests, those, a lot of times insurance does not cover those. So, but it's never the first thing I go to. Most people, if they actually work with a nutrition specialist, which one of the providers comes in with each of those visits, so those visits are covered by insurance. And if they do the supplements, which are generally low cost, most people don't even need to do a stool test. And then if we do get to the point that we're not getting anywhere, that makes me think, okay, we need to do a stool test because there's either a parasite or there's a bacteria that I need to know that. So I know which medication to give you. But that's not every day or every patient. So I generally do tell them, hey, call your insurance and just find out if they're going to cover it, because some insurances cover it, some will not.
So for the blood test, do you do just kind of universal blood test at a certain cost? So like for someone who doesn't have health insurance at all?
So if you didn't have insurance, I would take your symptoms and I would narrow that big panel down. Okay. And we have a self-pay list. I think if you're paying cash, if we did the whole full hormone panel, I think it's in the $400 range, but it would decrease because we would, because a lot of times when you tell me your symptoms, I'm like, I know that's your thyroid. I know that's your thyroid. Your periods are normal. You're not having a low libido. There's no hot flashes or night sweats, but you're fatigued. You're gaining weight. You're cold all the time. You're losing your hair. You're losing your eyebrows. I know that's thyroid. I don't want you to spend $400 on labs to find that out. So I'm only going to check a TSH, free T3, and a free T4. So yeah, if somebody's cash pay or has just bad insurance, then yeah, we definitely would do that for them.
Awesome. Thank you.
Yeah.
So from my friends, I know that you guys do these pellets, right? Are those typically covered by insurance?
So the actual pellet is not covered by insurance, but some insurances will cover the actual insertion. So for women, the actual pellet is $180, and then your insurance is billed for the rest of it. So you may or may not get a bill after that. If you do, I think it's in the $150 to $200 range for the insertion fee. But for a female, that pellet's going to last you about 4.5 months. For a man, it's a little more expensive. It's around, I think it's around the $450, $475 for the actual pellet, and then the same thing where their insurance is billed for the insertion fee. But that pellet is going to last them 5 to 6 months. But we do more than just pellets. So for testosterone, yeah, the pellet works great. I mean, if I could do a pellet on every patient, I would, but not everybody can afford that. So we do a lot of compounded creams. As far as women sometimes can get bioidentical hormones that insurance will cover. There's certain prescriptions that are bioidentical, they're cheap, they're available, widely at normal pharmacies. So with women, sometimes it can be easy. And for men, sometimes if they meet certain criteria, sometimes they can actually get their insurance to cover testosterone injections. And even if they can't, testosterone injections are pretty cheap. Talking like $50 would last you 2 or 3 months worth of testosterone. So yeah, we keep that, we keep budget in mind, especially in this day and age. Not everybody wants to hand us $500 and go get a pellet. You know what I mean? And sometimes you need to know that it's going to work first, or, once you put that pellet in, you can't take it out. So some people just want to try those, creams or patches or, pills before they commit to a pellet. It just depends on the person. And some of the people we were talking about, some of those men wouldn't exactly want to get a pellet, because after you've had a pellet, men cannot work out or do any heavy lifting for 5 days. So, our police officers or firefighters, unless they're taking 5 days off of work, that's probably not a good option.
Is that the same downtime for women?
It's only 3 days for women. Yeah, so women try to do it on a Friday, and usually by Monday they're good.
Brandy and I will be there on Friday.
Yeah, great. I think I've been kind of all over the place with this. What questions do you have for me?
I guess, just to kind of bring it all home, how do you, and this is actually for you, Emily, but it's also for the trainers too, is, individually, how do you see this potential relationship forming? What does that back and forth look like? Is it a direct referral? Is it a constant communication between practitioner and trainer if we've got the same client? What are some things to keep in mind regarding possible HIPAA? I mean, there's
Right.
Touch.
So if you just tell a client, hey, go in there, I can't give you information about them. You know what I mean? And I wouldn't expect you to give me information either. It would just kind of be up to the client. But, you guys, if you notice clients that could really use these services, just, send them our way, and vice versa. When we notice, patients that could utilize your services, just tell them, hey, right, you go right there. And if you'd like, you could even bring some cards in so that the providers could have that in their desk. And I always like doing that in office, having the cards right in a little drawer. So instead of trying to look up the information, I would just hand them the card and say, hey, go here. But yeah, with HIPAA, I wouldn't really be able to pick up the phone and say, hey, this is what I'm thinking with this patient.
Yeah, we kind of figured on the HIPAA. It's just one of those things. It always pays to say.
Yeah.
So,
oh yeah.
Remember, we can't talk about it, but yeah.
Do you think of anything else? Oh, did I tell you the nutrients? We do have nutrient injections. Those are on a walk-in basis, and you do not have to be a patient of ours to get an injection. So if somebody's just kind of feeling like they're in a slump, they can come in and get it a shot. We do have a skinny shot, which has the lipo and some B vitamins. It can help to speed up the metabolism and help with energy. We have some immune boosting injections. So if somebody's just kind of feeling sick, in order to get IV therapy, so actually in your IV, they would have to be established, and those would need to be scheduled. But those IVs can really help with adrenal support. And if somebody's been ill and kind of recovering from certain illnesses, that can kind of give them a boost.
What are we talking cost-wise on the nutrient injections?
It depends on the shot. Most of them are in the $20 to $30 range. But if you're a patient of ours, you'll be signed up for an email, and you'll always get our specials. We run specials. This shot is on sale this month. So you'll always know. What other questions do you have?
I understand you guys have quite a wait list for people to get in. It takes a long time to get that initial appointment. Where are you guys sitting on that wait list right now? Or how far out?
I am not sure, but so I do virtual appointments, so I could get you in tomorrow. So that's kind of the beauty of it. The in-person appointments do take some, depending on where the schedule's at and where the office is. Sometimes it does take a long time to get in. So that's where I come into play. So I could do virtual appointments. You fill out your new patient paperwork. We'd talk about your symptoms. I could order your labs. I could even go over your lab results virtually as an appointment. Obviously, I couldn't give you an appellate via a televisit, but I could prescribe any medication, and I could, like the creams and things like that. You could get started on those, or we could talk about the pellet, and I could get you scheduled for first available pellet. So yeah, that's kind of how we're handling it, because some of the offices are like really scheduled out for quite a ways. But yeah, you don't have to wait. If anybody's needing in, like, we can get them in right away.
And then when we send people your way, do we have them mention that they came from a trainer at the DAC? Is there any benefit to the client if we refer them over?
I don't know. Allison, do you know? Is there used to be like a referral card for supplements or something like that? I don't know where we stand on that anymore.
Yeah, that I'm not 100% sure on. I'm kind of just been brought in on this, but I can have Bridget address that and email you guys.
Yeah,
We that is something we have possibly discussed and is still in talks as this relationship develops. This is kind of like the first step, to get to know you with all the important the players. The next step is, I believe OnePeak is going to be scheduling like a in-club seminar for some of our members, so that some of this education awareness makes it out to the membership as a whole. The good thing is, the trainers, you guys will have the kind of the inside know of this is coming, and so you might be able to kind of better facilitate that. As far as the referral, again, still in works and development. I will say, if any of you have ever worked with somebody who does have some hormone issues, to see what they were like beforehand and then how they were like after, to me, that's a huge reward, because all of a sudden all the hard work that you were doing wasn't going anywhere. All of a sudden, just like, oh my gosh, where was this like the past 2 months? Yeah, but that is a good point, Christy, and that is something being talked about. We're just not sure what it looks like yet. So
yeah, and I was thinking less about like what we get out of it as trainers, but more about like, do the clients get a free shot, or is there like a benefit of coming from us? So
yeah, that's what I'm talking about too. That's what we're trying to figure out. Like, what does this look like? So it's pretty exciting, because the sky's the limit. But yeah, it's still in the talks. So good point.
And can I get that virtual appointment tomorrow?
You can.
We'll talk about that later.
Okay.
I not Christy and Brandy and Sean, not that you guys need any convincing after this, but I'll, little personal story to prop up OnePeak is, being in the military, coming back from deployment, I could tell that I just wasn't feeling that great. And when I had a regular provider do a blood panel, it was like, nah, you're fine. And they dug about that deep. And when I went into OnePeak, it was like, and here's your 5-page readout on everything. And of course, I knew enough to be dangerous to be like, okay, yeah, we got some things to talk about. Dr. D over there was wonderful. And yeah, so good stuff.
Kind of amazing to see people improve in such a short amount of time. It's not gonna take 6 months to feel better.
Mm-hmm.
Hey, anything else, guys?
I think I know we're good here.
Okay.
Good. Thank you so much for this and your
Hey,
time.
You're welcome. It was nice talking to all of you guys. And if you have any questions, or if you want an appointment, just reach out to the office and we'll get you taken care of.
Fantastic. Thank you so much for your time.
Yeah, you're welcome. You have a wonderful day.
You
All right,
too.
thanks.
Yeah.
Bye.
Bye. Thanks, guys.
I always wonder